Okay. Hello, my name is Micah, and today I'll be presenting my interactive game called Culture Pending Candida auris. The game was created in Twine and focuses on clinical reasoning, microbiology, patient management, and infection control. Here, the players will act as a hospital doctor responsible for diagnosing and managing possible Candida auris cases before final culture results are confirmed. I chose Candida auris because it's emerging multi-drug resistant fungal pathogen associated with healthcare outbreaks. It's important because it can resist multiple antifungal medications, spreads in healthcare settings, and patients can carry it without symptoms, and can also be difficult for laboratories to identify. I wanted to create a game that shows how complicated clinical decision making can become when dealing with infectious diseases. So, the objective of the game is to correctly diagnose and manage patients while preventing a hospital outbreak. Players must analyze symptoms, review patient risk factors, interpret laboratory clues, choose diagnostic tests, select treatment, and apply infection control precautions. The game also includes live vital signs that worsen or improve depending on the player's decision. Okay, so this is the code on Twine, and we'll just play that real quick. Oh, play. Okay. So here's the UI. I have a little patient here that will have quotes as we go through the game, as well as the doctor. Um, you are the on-call doctor at Ward 7. Mysterious drug resistant fungal pathogen is appearing in your hospital. Your mission: diagnose patients, order the right tests, choose treatments, and prevent a hospital outbreak. Okay, now we can click start shift. All right, so in total, we have four patients, and we also get scored on how many questions you answer correctly. So for this one, as you can see, our live vitals also tell us um, if the vitals are normal or alarming or dangerous. So right now we have orange for the temperature, heart rate, and the O2, but our blood pressure is fine. So is our respiratory rate. So our first patient is a 74-year-old female from it that is transferred from a long-term care facility with fever, confusion, hypotension, and a central venous catheter. She recently received a broad-spectrum antibiotics and had a 2-week ICU stay. So a few things that we could consider is the 2-week ICU stay, the broad-spectrum antibiotics, and invasive catheter that we have right here. And yeah, so our first decision, what is your initial clinical impression? The correct answer is this one: high risk healthcare associated fungal infection. Review exposures, lines, devices, prior antibiotics, and possible CORs precautions. Okay, now um, our vitals are the same, so we'll keep going. New lab clue: two blood cultures grow yeast. The first automated report says Candida Hamulani complex, and then or unidentified Candida species. So the final identification is delayed. What we'll do is actually request the MALDI TOF slash PCR confirmation, order antifungal susceptibility testing, and evaluate the central line. Um, this is correct because Candida auris may be misidentified by routine laboratory systems. The MALDI TOF is going to be a confirmatory identification method, and blood cultures and susceptibility testing also help determine treatment options. The central line is also important because invasive devices can become infection sources. We'll pick that. So here is our correct answers. As you can see, it's green. When you pick a wrong answer, there's going to be a red box here. Our second slide is going to be our treatment slash infection control decision. So the report says the yeast is isolated, species confirmation and susceptibility testing are still pending. Thus, there is a suspected diagnosis, which is a Candida auris bloodstream infection. So what we can do is this one. Start an echinocandin, remove, evaluate the central line if clinically indicated, and place contact precautions. So, contact precautions are important because Candida auris spreads easily in healthcare settings. The patient vital signs improve after proper treatment and infection control. So we'll click this one. And the result is that Candida auris is confirmed. Patient outcome improved. You recognize the threat, used proper testing, and made the right management decision. Now, there's also a little lesson down here. Lesson C. Lesson is CRs can cause serious bloodstream infections in very ill hospitalized patients. It is often resistant to multiple antifungal drugs and can spread in healthcare settings. And then this actually has 4 patients altogether. Right here is the next one. 63-year-old male is admitted to rehab after a recent ICU stay. One factor we can consider: tracheos- tracheostomy, no fever, and feels fine. So as you can see, all our vitals here are green, meaning they're roughly around the normal range. Okay. And however, his only concern is that his roommate tested positive for CRs. So we can go ahead and start this healthcare associated fungal infection, review exposure lines, devices, prior antibiotics, and possible CRs precautions. Okay. Okay. And then our next one, axilla/groin screening swab is positive for Candida auris colonization, but the blood cultures are negative. So what we can do is this one, recognize the colonization. But I'm actually gonna start just picking random ones because the recording is going on for a long time. And then you'll see how it acts whenever we pick wrong scenarios. So the wrong approach delays identification. CRs can be misidentified, and delayed recognition can allow spread. And then there's a little quote up here, and the patient shaking. Wrong test. We need to correct this fast. You either do the test or keep waiting for the final report without changing isolation, cleaning, or equipment use. We can choose this one. It shows the correct diagnostic direction. So here the patient stopped shaking. The lab begins working up possible Candida auris. Preliminary report. Yeast isolated, species confirmation, and then Candida auris colonization. And then let's see. Do not treat colonization, treat only with antibacterial. Start antifungal therapy, but skip infection control. So we can pick whichever one. And if it's wrong, case had complications because of delayed or incomplete management. So this one, we're not able to save the patient. As you can see, saved patient is 1 to 4. So that's basically it. There's going to be 2 more that will have different scenarios. And yeah, we'll just run through these. So at the end, after the very last patient, you can end your shift and it'll show you a final review. Candida auris is a drug-resistant fungal pathogen linked to healthcare settings. It can cause severe infection, especially in very ill or immunocompromised patients. Patients may be colonized without symptoms and still spread it. Correct identification, susceptibility testing, contact precautions, cleaning, and reporting are key. And then here we get a rank. A rank, strong clinical judgment. You handle most cases well, but a few decision allowed risk to remain. Final score, and then the patients we saved. Okay, and then play again, goes back. Okay.